My warmest greetings to all my viewers. I take a privilege to today to introduce Prabjot ji. Prabjot ji is with me here. She is a poetess. She's a MA in English. She's always all along her life been a teacher in various schools, English, and she loves poetry. And Harminder ji is a retired major. He took a premature retirement. He now teaches in MBA colleges. And Colonel Sandhu is my contemporary. He retired in 2021. He's a gunner officer. So I tell you about Prabjot ji. She had unfortunately, a breast cancer in 2019
Yeah,
when she had a breast conservation surgery.
yeah,
The tumor was removed, and thereafter, according to the type of cancer and the stage of cancer, you were given chemotherapy and radiotherapy.
yeah. And
But
then hormonal tablets also.
and because tamoxifen tablets also, or letrozole tablets, depending on hormonal tablets. Well, but after surgery, unfortunately, you developed gross lymphedema
In 2021.
in 2021. So this is a aftermath of surgery. I was discussing with you people, and I share with the my viewers also. This is not considered a complication of surgery. It is so common, about 20 to 30% people get it. So it's kind of a collateral damage. It's kind of a side effect, as we call it. And she's also developed a shoulder dysfunction. Her shoulder doesn't go up, it's only about this much. So these are the two side effects of collateral damage, which is very common after the breast surgery, particularly the axillary dissection. So I've been practicing this, surgery. I've been doing it for the last 30 plus years. From the very beginning, I've been very conscious about this side effect. And fortunately, I was so careful with my dissections that none of my patients has ever got this. None of my patients has ever got this kind of an edema or any shoulder dysfunction. So what I do, I share with my colleagues all over when I go for conferences also. I do an optimal axillary dissection, optimal, as much as it is required. I do not do any you know mm, I would say messy surgery in the axilla to pluck away, to peel off every lymph node. It's not required. We required a limited few number of lymph nodes to stage the disease, and if they are already big and enlarged, we often give chemotherapy first. So we don't really have to do a radical axillary dissection ever these days. And secondly, I mobilize the arm on the day one. I mean, when you come out of the table, I keep your arm like this. So shoulder dysfunction never
It was not
happens.
mobilized for me.
Never mind, never mind. So it is my, I share my experience with my colleagues, surgeons who are listening, that this is a preventable complication or preventable side effect. This is not that everybody will get it, but yes, we know and we accept it that 20-30% all over the world people get lymphedema, and people do get shoulder dysfunction also. So never mind. This we will take care now. Now that you've come to me, why did you come to me? You come to me with a recurrence of the breast cancer.
Yeah,
You come to me not for this.
I came for
No,
cancer.
you came that because the cancer recurred in your breast.
Yeah, at the
So,
same spot.
so well, so this time because the recurrence has happened in the same breast, so we said that it'll be better that we remove the breast. So we removed your breast about 4 5 days back, and the very same evening you were home, and I told you can go for a party if you feel like. You can do anything. There are no restrictions on you, and you never had any pain. Did you have any pain?
No.
No. So there is a pipe which is hanging out, which will stay in 5 to 7 days. I'll remove it. So you
And
had your surgery, I think, on Monday, and by the next Monday, your pipes will also be out. I've also, because I've removed the breast, I've also given you a silicone breast on table, so that when you came out, you did not feel anything missing. You felt as if you're as complete as ever. It's only in your private room that you would know that you don't have a breast. But in other day-to-day activities, you will never even notice that you don't have a breast, because a silicone breast has been fitted onto your body on the day of surgery. It is not inside your skin, it's outside your skin. It's called a prosthesis. It's not an implant. Implant is another thing. We have put it in a prosthesis. Prosthesis has got no morbidity. Implant is after all, a major surgery. So people who want an implant, we give implant also. People who want a reconstruction, we reconstruct also. But it all depends upon your needs. So I think you were comfortable with this option and we gave you this. So now you tell me, what are your questions?
Like with the silicone breast work and make me walk comfortably.
Do you not think that your body image as well as your you know your balance feels better because it's got the same weight and it's got the same feel, it's got the same looks? So it will definitely enhance your feeling of well-being. Okay, and it is also helping you, us as surgeons, because it's working as a dressing. It's supporting your chest, it's working, it's supporting your, the skin flaps as we call it. So it's lying there and it will be in every which way helpful. Yes, I know nobody in the world gives a prosthesis on table just after surgery, but I encourage all my students do it. Everybody who's trained under me, they do it. I've been doing it for the last 20 years.
And like how many days I have to wear it?
Oh, initially you wear it regularly for 15 days. Thereafter, it's your choice. You would like it. I'm sure you would like it.
I like it.
So at least you would wear it, at least when you're moving about. At home, you might want to remove it.
Yeah.
Any other questions?
Now that we have removed the breast, are there any implications for the future?
Removing the breast or breast preservation, the surgery is the same. It's only that you feel that the breast has been preserved or it has been removed. So it's only the psychological impact. So I, by providing you a silicone breast, have looked after that psychological well-being also. You feel as if
Any
you're
other side
complete.
effects in the body?
No side effect at all. Absolutely.
Like heart, any effect on the heart?
Oh my God, nothing. It's nothing to
Nothing.
do with heart. Heart is lying inside the rib cage. The breast is an outside skin organ. It's just a projection of the skin. A very, God made structure, but if we remove it, there is no side effect.
And I can use the lymphopress machine with this
Oh,
removal of
so
the
now
breast.
we would talk about lymphopress machine. Lymphopress machine is only a milking machine. It will be put on your body, on your arm, just like a BP instrument, just like a dressing. And it will compress your arm in a way that the lymph which is collected in your arm, it is milked out. So you would use it every day for 10 to 15 minutes. When you have the machine, we'll explain it to you. So that will definitely ease your lymphedema, because it's there now for about more than 5 years, 7 years.
5,
And
7
it's
years.
almost become a grade 3 lymphedema. It's not become grade 4 as yet. Grade 4 means it starts weeping, it starts developing wounds. So we'll give you lymphopress, and we will also work on a surgery for the lymphedema, which is called a lymph node transfer, or it's called a lymphovenous anastomosis. It's a microvascular surgery. We have the wherewithal and we'll do that.
And after how long will you do the surgery?
Presently, let us first focus on your full treatment of your cancer breast.
First, we'll have cancer treatment.
Definitely.
For how long will the cancer
No,
treatment
that
continue?
depends upon your, what is called breast panel, IHC breast panel, and your stage, that how long do we want to give you chemotherapy, and thereafter what all other treatment, be targeted or be it hormones, we want to give you. So at least about 6 months, let us first treat your full treatment of your breast cancer. And this is an old problem, 5 years old problem, 6 years old. It's been there since the past surgery, which you had in some hospital. Well, whatever hospital, it doesn't really matter, because one of my colleagues must have done it. So we become more and more careful as we grow in our surgical practice, that this complication, this side effect does not happen.
Sir, is there any risk that between now and whenever we do it, that this will progress from grade 3 to grade 4?
Well. So you are going to start LymphaPress from next week or this week onwards. So LymphaPress is going to keep it under check.
Okay.
So it will not develop grade 4 if we are doing our regular LymphaPress exercise.
So I have to be regular with
You should be
LymphaPress.
doing it. And physiotherapy also for your shoulder, because your shoulder is also
Milking
quite
has to be done.
handicapped. Nothing in it. LymphaPress will look after.
LymphaPress.
Will look after.
Okay. No milking.
No. So arm movements, yeah, physiotherapist will help you.
Arm movement that I can do myself.
Yes.
I know the exercises.
Perfectly. Anything else?
No, sir.
Karan Sandhu?
I just wanted this surgery part, what you said. How many sessions can we expect, and any side effects
Of the
Or-
lymphedema surgery?
of the lymphedema surgery? That's
Lymphedema surgery, I think we should leave it to at that time when we do. We are
Right.
going to do lymph node transfer at that time, or are we going to do debulking surgery, or are we going to do lymphovenous anastomosis? So all those things we'll discuss pros and cons. That we will, with my team, microvascular surgeon will be along, and we'll talk to you about it.
And this will-
Presently, you keep yourselves comfortable with the LymphaPress exercises.
And in chemotherapy, I have to have boiled food.
You have to have boiled food. Chemotherapy people will tell you about what all are the diet restrictions.
That they'll give me a diet chart.
Definitely, they will tell you what are the diet restrictions while the chemo is on. You would already be aware, actually. Last chemo also.
And they
you
gave
had-
me boiled food.
I mean, our chemo team will tell you what all you can take. Okay, our medical oncologist will guide you. Anything else?
No, sir. No, sir. Thank you, sir.
Thank you very much.
Thank you, sir.
Thanks a lot.